Hi, everyone. Thanks for joining us today. Welcome, welcome. So as people come in, just remembering to drop all your information in the chat so we know who is here. And then we'll start with our land acknowledgement and then pass it over to our fantastic Health Council and Public Health Specialist, Heather. Let me go ahead and share screen really quick. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nation, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. Right, and I will go ahead and pass it over to Heather.
All right, thank you, Sam, and thanks everyone for being here today. So good to see you all. I will go ahead and share my screen now. And I may or may not have to turn off my camera depending on how well my internet behaves today. So forgive me if I have to go off screen. But like Sam said, I'm the Health Council and Public Health Specialist here at the Alliance, and this is my first time giving a Health Council talk, so bear with me. But we have a couple of announcements before we get started. Thank you so much to everyone who has completed the surveys so far, both the comprehensive survey and the optimal budget survey. And just a reminder that if you complete all of the surveys, then you'll get a $25 gift card to Amazon. So again, thank you all so much for everyone who has completed their survey so far. We really appreciate it, and it really helps with our advocacy efforts to be able to have the information that you'll provide about all the different services that you're providing for your community.
Heather, and if you
Yes.
don't mind me adding, I know there currently is under the DOH scope of work, Health Council has just did the health impact survey. And so the surveys from the Alliance is actually in addition to what DOH is asking for as well, the survey that's due today. So I just wanted to make that distinction. Yes, I'll hand back to you, Heather.
Thank you, Geraldine. Yeah, there's lots of surveys coming at you also. Thank you for bearing with us and for completing them all, and for DOH also. All right. So just a little quick poll. Today we're going to be talking about federal grants, how to find federal grants, and the application process. So just a quick poll, if you have ever applied for a federal grant, if you could just put that in the poll here, and then there'll be another poll shortly. If you have applied for a grant, what was the outcome? And also welcome anyone to come off mute if you want to talk about any of the grants that you've applied for or worked on, or anything you'd like to share. So looks like a few people have applied for grants in the past, and 67% so far said no. So hopefully by the end of our talk today, you'll feel empowered to apply for a federal grant. All right, so I'll give everybody a little bit more time to answer the poll, but we'll move on to the next slide. All right, so there are, here's the next poll. If you have applied for a federal grant, if you wouldn't mind sharing what the grant was and what the outcome was. So were you able to secure funding? What type of work were you able to do with the grant? All right.
And Heather, while we give those a chance to answer just a few questions in chat about what surveys due today from Elizabeth and Joanne.
So the surveys that are due today, there was a county survey. The New Mexico Association of Counties was looking for survey data, and then we had requested that our comprehensive survey be completed by today. But welcome to take more time on those, because like we said, we know there's a lot of other DOH surveys too, and just a lot of surveys all around.
Yeah, so we're happy to also, I think we had talked with Val and our team about extending that until early December. But I think after this, Sam, if you don't mind adding, we can send an email to health councils in our listserv of all of the links to the survey. So, but if you have questions about those surveys, Heather and I can stay on too after health council talk to just kind of give more context, and yeah, answer questions.
Absolutely. Thank you, Jerry-Lynn. All right. So it's not letting me see the answer to the poll, but thank you for everyone who answered. Let me see if I can see the results. No, okay. All right. So for funding, there are a lot of different funding sources available out there. And I know a lot of you have sought out funding from various areas and various sources. So today what we're going to be talking about is federal funding. And I know federal grants take a lot of work, take a lot of capacity, and they may not be an option for all health councils, depending on governance structure, depending on the capacity of the health council or other components. So I do want to acknowledge that. But at the same time, I just want to share some information and some resources that hopefully will be helpful either now or in the future to ensure that health councils are able to secure federal funding to be able to continue the vital work in communities, because a lot of times federal funding is pretty significant and it can really help expand capacity. So hopefully these resources are going to be helpful. So as we know, health councils were able to be beneficiaries of a federal grant from Centers for Disease Control and Prevention and also WK Kellogg. So over the past 3 years, that funding was able to help with operations, to help with capacity. And so for the first time in 13 years, health councils were able to be funded at an adequate level to be able to provide a lot more work in their communities. So at $50,000 per health council. And just a few of the accomplishments, I know there was a lot more done than just what's here, but vaccine equity, health equity, conducting electric chip assessments, data collection, creating those chips, capacity building, and unfortunately funding for this grant ended this past May, but hopefully we'll be able to secure more. So again, just a little bit of an outline of what that funding has looked like. As we know, health councils were totally defunded in 2010 and got a little bit of funding at a time for the next couple years. And then that CDC funding was really a significant boost for health councils and enabled you all to do a lot more work. All right. And if at any point anyone has any questions, feel free to speak up. I know sometimes I may talk fast, so if I'm talking too fast, just let me know, or feel free to ask a question at any point. But every year there are 26 different federal agencies that fund over 1,000 grant programs. So this funding can go towards educational institutions, organizations that focus on the arts, science. Federal grants provide funding for projects and ideas that are deemed as something that would provide beneficial services to the public, as well as those programs that could help to stimulate the economy. So federal funds also go towards research, towards agricultural programs, towards disaster recovery initiatives, or, you know, like, for example, CDC funding after COVID or after natural disasters. And so some of those grant-making agencies include the United States Department of Agriculture, the Department of Health and Human Services, and the Environmental Protection Agency, which the Alliance has partnered with Farm to Table to submit an EPA grant. So we're waiting to hear back from that. But so with getting started with grant writing, there are a lot of different components. There are a lot of different types of funding opportunities, and each one has its own requirements. And so an important piece of the application process is understanding those expectations, understanding those requirements, like who is eligible to apply for grants, which we'll talk about shortly, and then the different documents that you need to include in the proposal. Also, it's important to have a clear idea of what you're asking for specifically to be funded, and how much funding you're going to need for that. So when you create that proposal, you want to make sure that it's compelling. It outlines all of the amazing work that your health council is doing, the mission of the health council, and the specific program that you're looking for funding for, and also what impact you think that it's going to have. And so then identifying those funding opportunities, again, we're going to talk about this in a little bit too, but it's important to research potential grant opportunities that align with the work that you're doing as the health council, because sometimes I've seen this in past organizations I've worked for that you'll see a grant and you want to apply for it, but it doesn't necessarily align with the work that you're doing. And in turn, you have to do more work to get that funding. So a really important piece of federal grant funding is just making sure that the funding aligns with work that you are already doing. You may have to do a little bit more, but just making sure that you're not going to have to take on a ton of new work. So there are different opportunities, private foundations, corporate giving, which we're going to talk about in a couple weeks, but today we're going to focus on government grants. And like I mentioned before, just carefully reviewing the guidelines that are provided by that funding organization, just to make sure that you're eligible and that the project that you're wanting to work on fits with their priorities. Canva isn't cooperating. There we go. And then the next step is writing the proposal itself. So a lot of times, well, almost all the time, federal grant RFPs are really specific in what they're asking for, which can be kind of tedious, but it also makes the process a little bit easier because you know exactly what they're asking for. So a good thing to do is just kind of make your own Word document with each question so that you can make sure that you're answering each one. You can kind of draft it in a Word document and then copy it back over into that portal or whatever they're using to accept the application. And then just making sure that you outline the goals and strategies and what you think the outcomes are going to be. And of course, making sure that it doesn't have any typos or any errors or anything like that. So making sure to have someone else look at your grant proposal to catch any mistakes. And again, from personal experience, I know sometimes you can look at a grant so much that you would miss a mistake because you just looked at it so many times. So just make sure you have someone else's eyes on it. And then another piece is the budget development. So this is something that we're going to talk about later on as well, but you just want to make sure that you're able to articulate how the funds are going to be spent in a very detailed way, and making sure that it aligns with those guidelines that the funding organization provides. All right, and once all of that is done, you can submit your proposal. So a lot of times there are pretty detailed instructions for submission. There's specific deadlines and things like that. So just ensuring that you have all of the required materials, the budget, the application itself, any appendices that they're asking for. And then you want to follow up once you have submitted that proposal, just to make sure that the funding organization doesn't have any questions or they don't need any additional information. And then just make sure you're going to be able to provide any additional details that they may ask for. And finally, if you are successful in your application and you get the grant funding, That's when really the work starts. So you just want to make sure that you're able to manage the funds according to the grant agreement, according to the budget that you submitted, and then going through the reporting process and everything like that to make sure that the project is carried out in as it was outlined in the proposal. Oh, sorry, Geraldine.
Yeah, I was gonna add too, if you can speak a little bit to the commitment letters. I know like we've run into some of that, right? So a lot of the times, if you have an application and you say you're going to work with a certain organization or a partner or community-based organizations, having the time and making sure that you're spacing that out in time for the submission, that you get those letters of commitment or letters of support that need to be submitted with a grant. And so just for an example, we're applying for an EPA grant focused on, I think, access to healthy, nutritious foods and the impact on climate health. And so we reached out, to a few health councils to get those letters of commitment, also collaborating partners. And so that can also be very time consuming, explaining what you do know about the grant and, some of the scope of work and some of what's been outlined as part of the grants. So just being sure that you have that and you're thinking about that. And I will pause. It looks like Gina from Doña Ana has a question.
Also a comment in regards to your proposal writing. When you're doing your budget and the activities that you're going to be doing throughout the grant, make sure that those align perfectly, because sometimes you see a description of a budget and it doesn't align with the activities that you're doing. So that's very important to see if it's congruency in that as well.
Yeah, for sure. Thank you, Gina. Anyone else have a question or a comment or anything? All right. Well, we will keep on going. So in terms of eligibility, there are a few different types of agencies and organizations that are eligible to apply for federal grants, and those include tribal governments, county and city government organizations, state and local governments, and then nonprofit organizations. So that could be either with or without 501c3 status. And so based on governance structure of your health council, the grant application would need to be approved by either your fiscal sponsor or your tribal or county government. And sometimes that can kind of be a little bit of a longer process because the funding would have to go through them. But we do have another quick poll. If everyone can share their governance structure and what you consider like the pros or cons of applying for federal funding from your perspective as the health council. And I'll give everybody a little bit of time.
And also for those who want to share openly, yeah, feel free to raise your hand or unmute.
Thank you, Geraldine. All right. So I'm not sure why it's not letting me see the results of the poll, but thank you to everyone who's participated. I'll give everybody just a little bit longer. And again, if anyone wants to share at any point, feel free.
I'm happy to read them out for you when they're all
Yes,
done.
Sam, that would be great. Thank you. Because all I see is the question and get a QR code or in the poll. So
Okay, perfect.
thank you.
So I'm gonna close it in about 5 seconds, and then anybody else who wants to contribute, feel free to drop it in the chat. And that way we can still see your responses and efforts. Okay, I'm gonna close it now. And okay, So Sarah Bowman shared, about a fiscal agent and sponsor. The specific term has been debated recently, as well as the fee percentage. And their current agent believes that, they are not paid enough. Another guest stated that they're a nonprofit and haven't applied for a grant, so they're not sure about the pros and cons. And then Eugenia shared county government, so the decision is really up to whatever strategic planning structure is mandated. And then someone said, thank you.
You're welcome. Thank you all for your efforts and your answers. I appreciate it. But yeah, we're gonna go on to our next slide.
Oh,
So,
Mm.
sorry,
you
go
do-
ahead.
yeah, I do have a follow-up question. And so and I guess for the person with the strategic plan, if the priorities don't align with the health council, and feel free to unmute if not, but just thinking about how we support health councils, right? If the county strategic plan doesn't align with the health council, you know, what would that look like at a community level? Oh, and I do see Brenda, and that might be your answer, so I'll pause.
It's not my answer, so I have a different issue.
It was actually mine, Geraldine. I'm sorry, Brenda, for cutting in. Yes, if it doesn't align with the structure that we have, because we have a board to follow as well. We try to, for example, I was really going for that EPA grant. I really wanted to work on that, but it's not up to me. So that's why I provided who could work on that, who could do joint efforts and to see that through, because I think it is a need, but not specifically for what we're seeing here at the county. But I think that if there's the funds and we see that food scarcity and, you know, environmental challenges, I think it's important to follow or go for that funding. Hopefully that answers your question, Geraldine.
Yeah, no, thank you so much. I think it's something at least most of the counties may be experiencing.
Right.
That
Especially New Mexico. Mm-hmm.
Awesome. And then I did see Brenda's hand, so.
Yes, I was trying to type and didn't type fast enough for your poll. We are a 501c3, so we are able to, you know, apply for our own grants. But the current federal grant we're looking at requires a different structure than what we have as far as employees. It requires that you have a full-time person getting benefits from your organization, and we only have contractors. We're all considered contractors. And so that caused us an issue, and we then had to find somebody else to be our fiscal agent. And then, of course, that takes up part of your thing. And the other thing that we were concerned about is it talked about needing, I can't remember the word they used, but basically accounting practices that we weren't quite sure, because we're just growing, that we have that kind of accounting practices that they were requesting. So those were some of our roadblocks.
I used to be a grants facilitator for in El Paso. And so going after federal grants is a lot more challenging than going after foundations that can provide money. But I think that there's a lot of challenges as a nonprofit to go after federal grants. So I totally understand, Brenda, what you're saying. I don't know if you guys have the capacity to grow or not. You know, that's another thing too that you have to consider. I think reading the FOIA, the announcement, is really, really important to know exactly if you are able or what are the requirements and if you are going to be able to meet them. And if not, you know, because it's a lot of time, like Geraldine was saying, getting those letters of support we used to provide letters of support and in detail say this is the type of support that we're going to provide 20 hours of in kind for whatever we were going to do depending on the project.
Yeah, thank you both. Brenda, what was the grant that you all were applying for?
And we're looking at a drug-free communities grant
Oh,
that we hope to apply for. I think it goes out in May or March, maybe.
mm-hmm.
So we're just trying to get all of our pieces together before we even start writing. And
For
it
sure.
has a lot of pieces.
Yeah. Yeah, I think that's definitely a common theme in federal grants is there's just so much prep work that has to be done. So there's usually a lot of funding, but there's also a lot of work that is involved for sure. But we as the Alliance are here if there's anything that we can help out with as you all are going through this process. So any other questions right now?
Heather,
Okay.
I did see one. Someone asked, I'm not being political, but how are federal grants potentially going to be impacted? And our health council is preparing for alternative funding. So it looks like a health council responded saying, our council is ready, planning ahead to become more independent on community, business, and private donations. We are meeting with an attorney to pursue nonprofit status, for the political issue and fiscal agent fee issues.
Yeah, I definitely think that's a good idea to try to pursue lots of different grant sources. I unfortunately am not able to really speak to what the federal grant landscape is going to look like with the new administration. But I don't know. I don't want to get political either, but I do hope that there will still be opportunities for us. That's kind of my stance. Sorry, Geraldine, did you have something else?
Yeah, and Val, feel free to chime in, but because health councils also are under state mandate, House Bill 137, a lot of the times when the Alliance is doing advocacy and meeting with foundations, as well as like CDC, because I think we had mentioned in the beginning when CDC funds ended, Val was already at CDC's door, WK Kellogg, asking for reinstatement of funds for health councils. And the pushback that we got was, this is state funding. I'm sorry, health councils are under state mandate. So a lot of the times the reason for the turn down was because of the mandate and saying that it was essentially the state's responsibility to fund health councils. So I hope that answers your question. But yeah, I think that part of our advocacy efforts is to really work with DOH around DOH's executive budget, just because health councils are under state mandate, but also, building the capacity for health councils to apply for their own grants outside of that funding, because is definitely an opportunity, right, to expand operations, capacity, programming, things of that sort. So I'll pause to see if Val wants to chime in.
Yes, my friends, and I'm actually thank you so much, team and health councils, great questions. I am actually putting a bunch of resources that came through the National Council of Nonprofits around, nonprofit, nonpartisanship, government grants and contracts for next year, new guidelines, 2025 tax reform. So I'm going to put it in the chat in segments, and we'll also be sure to upload the training that was provided on these topics by the National Nonprofit Council of Nonprofits, so in Mighty Network, so that you can have access to that and view it at your leisure. And we will keep our ears very close to the ground as we learn of any updates on the federal grant piece. We'll be sure to keep you informed through Mighty Networks, the Monday Health Council newsletter, so on and so forth.
Thank you, Val, and thank you, Geraldine. All right, any other questions for now? All right, we'll keep going. So when you are applying for federal grants, there are a couple of systems that you have to set up accounts with and go through. And the first of those is sam.gov. And that is just kind of like a way to identify yourself as either a government or nonprofit entity so that you're able to apply for grants. And then you use that login to create a login for grants.gov. And that is where you can search for different grants and different funding opportunities. So they have a little search bar that you can type in, for example, public health or environmental health or substance use or anything that aligns with the specific priorities that you all are working on. You can search for grants that way. And it is pretty user friendly. It's a little bit overwhelming sometimes when you first look at it, but that search bar is really helpful and really a good way to kind of narrow down what type of grants you are looking for. All right. And so
So sorry, can we go back, Heather, because I think there's a piece here with sam.gov and grants.gov as 501c3 for health councils who are 501c3. I think other ones, there's several, if it's your first time, there's several steps before even going into research, like registering, getting your, oh my gosh, they have like 2 specific numbers, registration numbers. One is called the DUN and the other one is the EYUC. And so you need to, in your registration process, which can feel a bit rigorous, you have to make sure you have those numbers ready to go when you are then researching for grants or applying for grants, because the grant portal is going to ask you for those identifiers. And I want to say I've spent quite a bit of time with folks at SAM and grants, and there's another one, and they're very, very helpful. And they do have a lot of tutorials and very easy to navigate. But if you're still, feeling like, okay, I'm still not clear, the customer service folks there are very, very helpful with helping you navigate and get all your ducks in a row.
Yeah, thank you, Val. Yeah, there's lots of video tutorials. There's lots of different, just like grants.gov crash course of different ways to kind of learn the ropes of the process. And of course, we are here to help as well. So just a little overview of sam.gov, like those numbers that Val mentioned. So it's the System for Award Management, and it's a registry for any organization that does any type of business with the federal government, including grantees. And so it's a centralized place that federal grantees are able to get information about grants. And like I mentioned before, anyone that is looking for federal funding has to register at sam.gov before applying to get the unique entity identifier and to designate a business point, an e-business point of contact. So it's free to register, but it does have to be renewed annually. So I think after the first registration, the process is a little bit easier, but it's still something that you have to do every year. Yes, Val.
Yes, and another thing with sam.gov, and I think there's like 3 portals that kind of interface with each other and authenticate the information that's being registered in all 3 in relation to that one, say 501c3, for organizations that may be virtual. These systems require a physical address that you have to authenticate. And the authentication happens, like, let's say with any kind of like mailer, like a liability insurance mailing or the bank statements mailing that has your physical address. So there's some steps there that you have to bring the form to your bank or whomever and get it notarized stipulating this is a physical address in addition to proof of address. So I just wanted to share that because I know that there might be some health councils who are 501c3s who are virtual, right? So keep that in consideration.
Thank you, Val. Yeah, there are just so many steps involved, and some of them are things that you wouldn't necessarily think of, but definitely a lot to prepare for. And then once you make it through the SAM.gov process, you're able to then register for grants.gov. And so you use that UEI number to create your grants.gov profile. And then you use the same email and same login and everything. And then you're able to search for and apply for grants. So hopefully by the time you get to the application process, you're not already like tired of the federal process, but all right. So just a few ways that you can find these federal grants. So as I mentioned, grants.gov, they have a lot of different ways that you can search. So you can use a keyword, like I mentioned before, opportunity status. So like, is it open to a specific type of agency, who's eligible? There is also a website called Grant Watch, and it will send you like email notifications. You can put in what specific grants you're looking for. And you can also search by state or by issue area or anything like that. But it does require a subscription. I think it's like $150 a year. But it's a good resource, but it is not free. And then you can also search by government agency. So a lot of these agencies like EPA, like CDC, like HHS, you're able to go on their website directly and find grants there. So just a few resources. And if anyone has any other resources that they've used or know of, please feel free to drop it in the chat. All right, and then there are several different phases of the federal grant process. So the pre-award phase is really the beginning of the grant life cycle. So this includes the FOIA, the announcement of the grant opportunity, submitting the application, and then the review of the application. So funding opportunity announcements are published based on legislation in the specific agency budget. So that's how grants are determined and when they can be awarded. And the funding opportunity announcement includes information like eligibility requirements, other information. And once that opportunity has been identified, the next steps are registering to apply for grants and then completing the application. So the actual review process can vary based on what type of grant was applied for, but the steps of that review process usually include a screening by the funding agency to make sure that the application is complete and that all the information is there, a programmatic review of the application, and then a review of proposed budgets. And then after all that is done, the award decision and announcements are made. And so now we're going to look at some of the different components involved in the application process and the grant proposal itself. All right, so like I mentioned before, the proposal is really what is going to make or break the awarding of a grant. So you want to make sure it's as compelling as possible, that you're able to include as much detail and as much data on the work that you're doing as possible. And all of this information is available on Mighty Networks. So please don't feel like, I know there's a lot here, so it is available to you. And like I said, we are always here to help, but you're going to start out with your introduction or executive summary. And this is just pretty short. It just includes your name, the amount of money that you're requesting, a short description of why you need the funding, and just make sure how to indicate how your request for funding fits in with the guidelines and the interests of the funder. And then the next piece is the statement of need. And you just want to explain what need that your health council is going to be able to address. Talk about your demographic population, your target population, the geographic area that you're in. And like I mentioned before, this is where it's really helpful to provide statistics and examples just to show what the need is and why you specifically need this funding in your community. And then the next component is the project design and the methods. So what is it specifically that you are going to do to meet this need? So just give a brief overview of your project, include the goal, the objectives, how you're going to carry them out. And then I'm sure we're all familiar with SMART objectives, so just make sure that they're measurable, they're specific. You have a timeline for the project. And then you want to ultimately describe what is going to be different for your target population as a result of your project. All right, and then your organizational description. And again, this is just a short description, but just you want to really focus on how your organization, your health council, is going to be able to meet the specific need that you've outlined in your proposal. Just give a little history, give an overview of your programs, and connect what you're currently doing to the work that you are going to be able to accomplish with the funding that you are requesting. All right, and then this kind of ties in with what Geraldine was speaking about before with the letters of support. If you have partnerships or like partners that you want to work with, you want to make sure to reach out to them, give them as much information about the grant as possible so they know, what they're going to be helping out with. You want to outline who's going to be carrying out the project, what their qualifications are. So this is a good time to make sure that you have resumes on hand of people that are going to be working on a project, and like we mentioned before, those letters of support. And you're just going to describe what their roles and responsibilities are as part of this project. All right, and then the last piece is how you're going to evaluate the results of your program. So are you going to use quantitative methods? Are you going to use more qualitative methods? Are you going to interview people to see how their lives improved after the program? So you just want to include how you're going to measure those results. And then we have on Mighty Networks, we have a template for a compelling proposal that you can download, and all of these examples are going to be there. So reach out and let us know if you would like us to send that to you. And then also, a lot of times proposals want to know that you're going to be able to continue doing this work even after the funding has ended. So if you've gotten other funding or you're pursuing other funding, you want to list that as well, and just to show that you're going to be able to continue supporting this project once you do not have grant funding anymore.
Oh, Heather, I
Yes.
also just dropped it in chat too, so I know it's mostly on Mighty Networks, but there is a template for all the examples Heather just walked through on chat, so feel free to download.
Great. Thank you so much, Geraldine. All right. So again, just some of the different components, organization information, your project description, and this is all in that template. So you will have access to it. And then just for the project impacts, again, how you're going to reach those outcomes, whether it's hiring people, whether it's increasing hours that current staff are working, whether it's getting new equipment, or getting subscriptions that are going to help you carry out the work. You just want to make sure that you include all of those. And then your organizational background, how long you've been around, what you've been able to do so far in your community, and then some outcomes. And then for the budget, like we mentioned before, these can tend to be really detailed, but we do have a template available to download that kind of lists out different things that you may want to include when you're filling out that budget template. So things like personnel, administration costs, if you have an office space or if you have insurance you need to purchase or other indirect expenses, things like communications, outreach, printing materials, or having events, or having a website, or different things like that. Training, development for staff, for other members of the coalition, and then supplies, and then your total. So all of that is available in the template, and we can absolutely help you walk through that process. And then there are also sometimes different attachments that funders may want. So in addition to that budget, they might want details on what specifically you're going to spend the funding on. A lot of times they ask for a list of your board members, financial statements, like 990 if you are a 501c3, and then also that determination letter identifying your organization as a 501c3 or a fiscal sponsor. And like I mentioned, both Geraldine and I are available for technical assistance anytime you need, if you need help looking for grants, if you need help just going through the process. And in Mighty Networks, we have a whole resource library. And if you have not already reached out to Sam to sign up for Mighty Networks and get access to all of those really great resources and a great place to connect with other health councils, please make sure you do that. And then after the long process of applying is the award phase. So this phase starts once the application review process has been completed. Final decisions on which agencies or organizations receive funding are made by the staff at the federal agency that is providing the funding. So these staff review all the applications and they make recommendations on which organizations seem to be the best fit to receive that funding. And then those recommendations are then reviewed by individuals at different levels within the agency to make sure that funding decisions are unbiased and they're fair and they've been reviewed by a lot of different people. And then as for award notifications, when those final decisions are made, the agency then sends out a notice of award to the organizations that have been chosen to receive that funding. And this notice is like a legally binding document. It announces, and when an organization accepts a grant, they are then obligated to complete all the different terms and conditions of that grant. They're subject to federal statutes, regulations, policies, and different requirements. All right, so I know we don't have a whole lot of time, so I'm going to try to speed up. But in that post-award phase is when you are implementing the program that you've gotten funding for. You're going through and doing all of the activities you outlined in your grant application. You're doing the reporting, and this usually includes programmatic reporting and financial reporting. So you're explaining not only what you're doing and what the outcomes are, but how you're spending down the money in the grant. You're also reporting on the performance metrics that are outlined in that grant agreement. And these monitoring and reporting requirements are in place to help make sure that the funding is, there's transparency, grants are carried out efficiently, and to ultimately prevent any fraud, waste, and abuse by government funding. Usually there's a grant management officer and a program officer who are designated to a grant and are able to work with grantees throughout the whole entire life cycle of the grant. And they review reports, they might conduct site visits, and it's just good to maintain close contact and communication with them to make sure that you're on track with everything and they can give you a lot of help and assistance. And then for closing out the grant, just submitting those final reports, programmatic finance and progress reports, usually within 90 days of the end of the grant. And then the federal agency that awarded the grant will review those reports to make sure that everything was compliant, all the grant funds were spent appropriately. And then once those have all been submitted, then the grant can be officially closed out. All right. And so we talked a little bit earlier about some of the pros and cons of federal grants. And so some of the pros, like we mentioned before, there tends to be a lot more significant funding amounts with these federal grants, just because they come from larger entities that have a lot more funding. So they're able to provide higher amount of awards. They tend to be more stable just because oftentimes they're carried out over a period of several years. And also government funding is just usually more reliable since those federal funding commitments have to be honored. And like I mentioned before, they're focused on agencies that are doing public good. They usually support projects that are, focused on public health or focused on environmental health that are going to benefit the public. And then as much as the application can be lengthy, it is pretty straightforward and there's a lot of specific criteria and specific guidelines. And then for cons, the process, as straightforward as it is, it can be complex, it can be lengthy, it can just take a lot of time. There's a lot of documentation required. And then the process itself from applying to receiving funding can take a long time. It might be several months, depending on the speed of the agency that you're working with. There tend to be more restrictions with federal funding. There may be, like has been mentioned already by some of the health councils, there might be rules on what type of staff you have to have, or like Val mentioned, you might have to have a physical address, or there's limits on how the funding can be used. So that can be kind of limiting. And as we've mentioned, they can also be dependent on politics. When leaderships or administration changes, sometimes there may be changes in government funding priorities as well. So that can impact the availability of grants. But, okay, any questions at this point? I'm not sure if I missed anything in the chat, but if anyone has questions or comments, these are just some resources to help you with grant proposals, and they're all linked here in this slide deck, and we can absolutely put it in Mighty Networks as well. But anyone have any questions at this point? All right. So like I mentioned before, we have Mighty Networks available for everyone. It's a really great resource. You can post links to events that are happening in your community. You can post resources that you found to be helpful. You can post requests for resources if there's things that you're looking for. Yes, Geraldine.
Yeah, if you don't mind, I can do a share screen if we have enough.
For sure.
Okay. Cool. Well, this is a resource library that we developed. And you all here at the Health Council talk today is kind of getting a glimpse of what that looks like. So as you all know, we have our hubs, I'll just show that very quickly. It's loading, but events, things that you can post. Yeah, any events that's happening in your community, any trainings that the Alliance sees, we also post there. But this is something that we are actually going to open as well. We've been building out this library, and really it's to support the capacity and functions of all the health councils. So there's a section on getting started, talks about who are health councils, the roles, the functions, the history of health councils from 1990s. And then there are links to, how to engage with health councils. And there's actually an orientation deck for new health council members and staff. And so typically we'll do these orientations in partnership with the Alliance and also DOH staff. That's just a section. Our next section is we have around advancing equity. So looking at the social determinants of health, defining equity. If you'd like to develop a health equity committee, what does that look like? Doing a root cause analysis, some resources around learning about what systems change is, anti-racism. We've also got our land acknowledgement toolkit in there as well. Again, this is kind of built for health councils and we want to tailor it. So once it's open, we'll definitely share, have opportunities for health councils to connect with them about, you know, the library, their experience. Advocacy, as you know, all of our trainings around target audience, working with elected officials, some of our toolkits around emails, having what elevator pitch, some things that we've already been talking about and covering with health council. So that's all in one section. Another section on community engagement, you know, working with your membership, how to increase membership, working with county and tribal leadership, and recruitment, and working with hard to reach community members. Another section on communications and marketing. So developing your pitch, you know, working on social media, visibility and branding. And we have different resources for electronic, oral, and written communication and facilitation skills for your health council. Section on data evaluation and learning. So this is really all relevant to the health assessment and community health improvement planning that we all went through for the last 2 to 3 years, and we continue to build on that work. The 7th one here is a big one. So this is around capacity building, business practices around key document management, finances and budget, human resources, project management, looking at your current leadership and committee structure, your governance structure, different core functions, you know, how to have a high functioning health council, decision making, all the good things around organizational development there. But specific to this resource here, today's topic around resources and funding, I can just show you very quickly what that looks like. So this is the grants and contracts, getting started, you know, all the things we touched on, downloading your budget here, the guidelines that we touched on today as well, the proposal. So all of this is in one section. And the concept paper for budgets. This one was offered during our statewide annual meeting, and just additional templates that you may need as you begin grant writing. And so I will pause there, and I know we'll probably have time to really touch on the resource library sometime in the future. So I'll hand it back to you, Heather. Sorry.
No, thank you so much, Sherilyn. Yeah, that all those resources are available, so you can just get in touch with Sam, and I will reshare my screen just to give her info. So yeah, you can just send her an email, and so she'll send you a link that you can sign up. So yeah, I don't know if there's any questions, but I know we have a couple more minutes if anyone does have any questions. And if you have questions later on and you want to reach out, please feel free. Yeah, I will just, if anyone has any final questions or final thoughts or anything, definitely let us know. But if not, thank you all so much for being here today, and I hope you all have a great weekend.
And I think Val wanted to add just a couple notes.
Oh, yes, thank you, Sam. Sorry, go ahead, Val.
Thank you, team. Just wanted to let you know that the board has approved our NMHC Health Council membership agreement. So be on the lookout for an email today, throughout next week. And we're so excited to continue to be in partnership and be of service of you and in support of County and Tribal Health Council. So thank you. Back to you, Heather.
Yeah, thanks, Val. And